Hello, my name is Watson Lewis, and I'm here with Marcus Bradley and Daniel Copeland. We are second year physical therapy students, and today we will be discussing our research regarding the prevalence of musculoskeletal hip variations found in the anatomy lab here at PCOM, Georgia. Over the course of a 2 year period, 80 cadaver hips were dissected here in the anatomy lab. The muscles of the inguinal region have typically been described as having very few variations. Variations that were found in our anatomy lab include a variation of the psoas minor, psoas quartus, iliocapsularis, and iliacus minimus. Alterations in muscle morphology can have many clinical implications for muscle function as well as pain that patients may experience that brings them into the clinic.
My name is Marcus Bradley, and I will be discussing our results. Of the 29 cadavers, 8 muscle variations were found either unilaterally or bilaterally. 2 iliacus minimi muscles were discovered. Both were found to overlay the femoral nerve, leading to potential source of pain along the course of the femoral nerve in the thigh and leg. 3 psoas quartus muscles were discovered. One of the discovered psoas quartus had proximal attachments with ventral rami of L3, passing through the medial muscle's belly. Lastly, iliocapsularis is often located under the iliopsoas muscle. From our observations, only 3 variations of iliocapsularis were observed, which suggests that iliocapsularis was absent in 83% of our cadavers.
My name is Daniel Copeland, and I'm going to be discussing the implications of the muscle variations that we found in the anatomy lab. First of all, some of the variations, such as iliacus minimus and psoas quartus, could lead to nerve entrapment, specifically on the femoral nerve. This entrapment could cause pain and numbness and tingling that might go undiagnosed or diagnosed as something completely different. Another issue could be the procedures for surgery might be altered once surgeons actually open up the patient. Another issue could be something along the lines of the patient might have decreased range of motion. The extra muscles that are seen could be tight or stiff, which would lead again to musculoskeletal decreased range of motion, or just the compression seen with iliacus minimus or psoas cordis could cause pain associated with movement, which would then decrease the patient's range of motion. As previously mentioned, pain is a big issue that could be caused. Um, a doctor or a physical therapist or a PA could try to diagnose pain based on the location of the muscles, or run tests to diagnose, but being as there's extra muscle bellies, the test could come up as negative when testing the specific preset muscles that the tests were meant for, which would lead to either inaccurate tests or just, you know, some brushing under the rug is something that might not be causing the pain. The biggest thing that we as clinicians and physicians would need to do is possibly utilize imaging techniques like ultrasound, which are highly discriminative to anatomical tissues, and use those for diagnosing any issues that the patient may be experiencing, as well as preparing for surgery.